So first of all, constipation is a very common problem in children. It starts from even little babies before they're 1 year old. And it starts from as early as sometimes 6 months old. And it can recur at any time during the child's life and even into adults, actually. There are studies that shows that constipation is very common. In fact, there's a very good study that came from the United Kingdom which showed that more than 30%, about 34% of children between the age of 4 to 7 years actually has had constipation at some point. And that figure actually changes from time to time depending on different age groups. In fact, there are 3 different periods in a child's life where they are more prone to get constipation. First is when they start weaning them from milk to solids, okay? And that typically happens at about 6 months old. And then later on when they're toilet training, so usually from 2 years onwards. And then another time when they actually go to school. So these are the 3 times when their bowels have the most difficult time adapting. And then these are the times when constipation is at its worst. Okay, there could be many reasons. One of the most common reasons is actually they're not drinking enough water. There's not enough fluid intake in their, on a daily basis. And sometimes when you don't drink enough, then your stools become gradually harder and harder because your colon, your large bowels, actually absorb a lot of water from your stool. So when your stool is too much fluid is absorbed because stools are already dry, then the stool becomes harder and harder, and that's the onset of constipation. There are also children who actually don't have the appetite for fruits and vegetables. So fruits and vegetables are natural occurring fibers which are very important to promote bowel movements. Often parents don't realize their children have constipation until they have severe problems like pain, for instance. Or they're crying when they need to go to the toilet. But actually, constipation takes time to evolve. So typically, patients who are constipated, they've had irregular bowel movements for maybe a few weeks even before their symptoms actually began. One of the early symptoms of constipation is actually hard stools. Now, when a child is having hard stools, sometimes they don't tell you that they're in any discomfort, okay? But as it becomes worse, then they start to have pain, and the pain can be very sudden abdominal pain, sometimes after eating, and sometimes if it's very bad, the stool can be quite difficult to pass, and then they will cry when they pass motion. In fact, one of the very common symptoms I see is actually when children have passed some blood in their stool with hard stool. That means the anus has been stretched, and sometimes they start to have a little bit of a cut, or we call laceration, and they develop what we call an anal fissure, and then blood, streaks can be seen on the outside of the stool when they're passing hard motion. And this is a very common presentation, and it means that the constipation has been going for a while and perhaps not been picked up. What the parents should do is actually first recognize that, am I giving the child the right amount of water? Are they having enough fruits and vegetables in their diet? Okay, and in some children, just a simple modification, making sure they have enough fruits and fiber, vegetables in their diet, that may be enough to actually tilt the balance. When parents recognize the early symptoms, and they tend to, some parents do get quick help from seeing a pediatrician or another doctor, but there are some parents who actually think the problem is not serious because sometimes constipation can be intermittent. So sometimes symptoms can come and go. So they may be having abdominal pain today, but the following day they might be okay, and then it comes back again a few days later. So because the problem is not consistent, sometimes they don't think it's a big problem. And this is a very common reason why parents don't seek medical advice. Sometimes they only notice the problem is really bad when the child is having serious abdominal pain. Sometimes it's completely blocked, they're vomiting. Sometimes when they're passing, blood in the stool. So at that point, it's already very late. Correct. There are parents who actually try their best, and the children do seem to be drinking enough water, but there is a problem with constipation that keeps coming back. Sometimes you have to figure out, is there any biological problem? Is there any medical illness? For instance, things like hypothyroidism, where thyroid is not functioning well, or some other medical condition which makes them constipated. So we have to try exclude those possibilities. But majority of the time, it's a normal functional constipation, even in children who are drinking enough, but they perhaps have had problems on and off, and their bowels have become a bit lazy, and they are not functioning and pushing the bowels, the stools as well as they should be. So typically, the longer that you ignore the constipation problem, or you've been having it for a long time with not adequate treatment, then the more difficult it becomes, because the bowels have stopped to function well. And without medication, sometimes it's difficult to reverse the problem. But the majority of the time, we can help the child with simple medications as well as changing the diet. But in more severe cases, perhaps sometimes we need some extra treatment, and it may be that you have to see a pediatric gastroenterologist, which is a pediatrician who specializes in children's bowels, and they may have to do some extra tests and to see whether there's anything medically wrong, or is it just pure functional constipation issue. For an improvement in symptoms, usually doesn't take very long. Once we start the right treatment, and our treatment has to be adjusted according to the severity of the constipation and also the child's age, then usually we'll get some improvement within a few days. We will have to make sure that they are regularly followed up in clinic, to ensure that the issue is properly treated and dealt with before we can reduce and gradually hopefully stop the medication. Some parents, they will try some kind of herbal treatment or traditional treatment, and very often this kind of medications are not tested in children, and often we don't even know what's the active ingredient. So trying to try traditional medication first without knowing what's the content may cause more harm than good. And some parents, they are very scared to actually give the child oral medications because they think the child might be dependent on medication. And there is simply no problems with dependence on medication when it comes to constipation. If the child needs it for as long as it takes, then you must continue with the treatment. So don't be afraid to continue medication because you think the child is going to be dependent on it, because that will cause more harm than good. And then finally, a lot of people resort to using enema or suppository, so they insert medication in the backside to help stimulate the bowels, and sometimes it can be very painful, especially if you have a tear there. So we try to avoid using that on a regular basis. One more thing is, some children have this psychological problem where they are scared to pass motion. You do have to kind of persuade them to sit longer in the toilet. And the best time is actually to do it after they've had their meals, and give them all the time that they need. Okay, and also try to tell the teachers at school that the child has a problem with constipation, and tell the teachers not to stop them to go to the toilet when they need to, because there are some schools that teachers are very strict. They don't allow the children to go to the toilet when they need to. And sometimes the children are scared, or they feel like the toilet at school is not very clean, so they avoid going to the toilet as well. So you may have to talk to your child that it's important, if you need to go to the toilet, please do. Don't hold back. Don't hold on to your stools, because that will cause problems later, and your bowels may not respond to the stimulation that we need to go, and it will cause the constipation to get a lot worse.